We've got about one more minute here, so we'll make sure that people are able to get in and get their speakers working so they can hear well, and then we'll go ahead and get started. I see quite a few people jumping on now, so this is great. All right, it's the top of the hour, and I'd like to welcome all of you to the initial USU Colloquium professional development presentation, and I'm glad that you were all able to take the time to join us. I ask that you keep your microphones muted through the presentation to keep our recording clean. If you have questions, please place them in the chat. We do have time designated at the end for any questions that you may have. So without further ado, I'd like to introduce our guest speaker. Dr. Sabrina Friedman is a dual doctoral prepared, dual board certified in family practice and psych mental health for the last 28 years. She's been employed in higher education, public health, community health, and private practice, holding various clinical and management positions. Dr. Friedman has taught for USU since 2018, and we're happy that she's part of our team. Dr. Friedman received her master's in nursing /FNP from USC, postmaster's training in psychiatric mental health from Duquesne University, her doctorate in nursing practice from Rocky Mountain University of Health Professions, and her doctorate in education in organizational leadership from Nova Southeastern University. Welcome, Dr. Friedman. So happy that you're here. Go ahead, take it away.
Okay, thank you, and welcome everyone, and thank you for inviting me this morning. So today I want to talk about a topic that's near and dear to my heart because I see children in my practice, and ADHD has been something that I love to champion with my patients because the outcomes are going to be so rewarding. But today we're talking about adults with ADHD, and it's not just for children. It doesn't go away magically when you turn 18. So why are we going to discuss adult ADHD? ADHD is well accepted in children and understood, but the diagnosis in adults is not often done. It's not often treated, even when patients are presenting with obvious signs of ADHD. So why is it missed in adults? There are types of cognitive biases that influence accurate diagnosis and treatment. There's a lot of stigma to adults coming forward saying they have ADHD. The medical community may have a bias that it's being overdiagnosed, and I think now, while it's more acceptable, there is still that bias, especially with companies that sprung up over the pandemic that were specifically to diagnose adults with ADHD. And many providers see patients as drug seekers, which keeps them from diagnosing, keeps patients from getting care. There's also the issues with overlapping symptoms with other psychiatric diagnoses and the lack of confidence of providers. You know, many providers in primary care do not feel comfortable diagnosing and treating, dealing with the medications that are involved that are controlled substances. And adults, what I didn't say on the last slide, the adults many times are able to mask their symptoms more successfully, of course, than children. The prevalence, adults with ADHD is 4.4% in the United States, 2.8 worldwide. That's 1 in 22 adults that are diagnosed within the US. It's higher in men than women in the Caucasian population as opposed to other ethnic groups. And really some of that has to do with the fact that mental health is not seen as something that should be brought to the forefront or discussed or talked about, treated in some of the minority populations. the diagnosis is growing, and it's growing 4 times faster. And then a lot of that has to do with new companies that have come forward uh, to try and diagnose adults with specifically ADHD. But fewer than 20% of adults overall still are not diagnosed and treated appropriately. So, my hope with this talk is that it's good for my colleagues in nursing, but for those of you that aren't in the healthcare field, that if you or someone you know in your family, friends, this can give you some information so that you can take it back, discuss it with your primary care provider if you think there are symptoms that are prevalent and should be looked at. We also look at environmental risk factors for developing ADHD, and these are listed here, and these are long-standing: prematurity, maternal stress, low birth weight. Substance use is a huge one. Tobacco use, there's an association, not a direct cause. Alcohol use, illicit stimulants and other drugs, lead, environmental toxins, early childhood incidents, your ACEs, and of course, a brain injury. What are the types of ADHD? And this is something I always try to correct with patients. Nowadays, people still say, oh, I don't have ADHD, I have ADD. There technically is not a ADD diagnosis. It's all ADHD with you having primarily inattentive type. That's what people say is their ADD. You have predominantly hyperactive, impulsive type, and you can have a combined type of ADHD. So when you're being screened and diagnosed, this is part of your diagnosis that's made. Which type do you have? Now, in psych, we use the DSM as our Bible for coming up with our diagnoses. One of the things that's being currently talked about to change is that we don't formally have a diagnostic criteria section within the DSM for adults. We have just added to the the child's section, and we don't have that criteria that's separate for adults. So at this point, this is what we have. So you have to have the inattention or the hyperactivity and impulsivity, and that is possible even as an adult, or you can have a combination of both. You also have to have 5 additional symptoms, which are on the slides to follow. And your symptoms must impact 2 different areas of your life. So it can affect your academic if you're in school, your occupational if you're working as an adult, but also say your social life, your home life, your relationships. So 2 areas. And these symptoms that you have, which we'll look at, have to be present prior to the age of 12. It used to be the age of 7. And then they realized that many children are not diagnosed when they're young, very young, 6 or 5 or 6. So 12 was more reasonable. Now we have the slide that talks about some of the criteria. When I talked about those 5 additional symptoms, so some of the inattentive symptoms, and these are general symptoms, we're going to get to how they change as an adult, but even for an adult, being forgetful, distractible, losing things, not completing tasks, not being able to hold attention, doesn't seem to listen, can't follow through on instructions, and having difficulty organizing tasks. These are the inattentive symptoms that patients or individuals can have. Someone you know may have these, okay? For hyperactivity symptoms, interrupting people, being intrusive, having difficulty waiting your turn. So they're standing in line at the grocery store, very upset that they have to wait when someone is taking more time in front of them. Again, easily distracted because they're not being still, talking excessively, always seem like they're on the go, um, and having difficulty just working quietly. So these are general, like I said, these are general symptoms that we see in children, we can see in adults, but adults do not report those textbook symptoms per se because they were developed for children. They often report anxiety, depressed mood, depression, stress secondary to their jobs or school or their relationships. And because they come forth with these types of symptoms first, they aren't seen as ADHD. So they're being treated for anxiety, they're being treated for depression, they're being treated for just not being able to cope. They're just sent to therapy for stress reduction, and the diagnosis of ADHD is missed. So it's important to recognize that these symptoms may be more than those, and that it may be some undiagnosed ADHD. So in the adult, when we say you have to have the inattention or the hyperactivity plus 5 other symptoms that impair your function, this is what we can look at. We can look at the functional impairment and then pair it or match it up with the DSM diagnosis that it can match up with, so that you go, aha, maybe this is ADHD and not just depression or anxiety or stress. So those functional impairments in work are really the same. You know, they are not paying attention in a meeting. If someone's talking to you, you start looking away, getting distracted, being distracted on the internet, monopolizing the conversations, being late for work, being late for meetings, working long hours with the bare minimum requirements of the job. So a task that would take most people an hour is taking you maybe 3, 4 hours to get it completed or longer. Fidgeting with office supplies. Procrastination, a big one. I've had patients over the years, I've had district attorneys and deputy directors of departments. I've had medical residents, chief residents in their medical training who are having great difficulty completing and staying on task and have lost or on the verge of losing jobs or positions. You have conflict with your colleagues. You forget to return calls, you forget to return emails, you don't complete paperwork correctly or incompletely. And that's one of the deputy director I had years ago. Her desk was just piled up with reports that she wasn't getting done. And she said, I can look at them, I know I need what needs to be done, and I just can't get started. At home, not doing tasks, not completing tasks, hyper focusing on fun. So, you know, parents will say that about kids, but it's still the same with adults, you know, hyper focusing on video games, on sports events, whatever interests you, you can do that all day long. And is what confuses a lot of people, because they say, if you can do that all day, how come you can't get your work done? And it's just a different type of focusing of where your attention lies. But you can't pay your bills, you forget to pay your taxes, you forget to pay your rent on time. All those things are a problem. Messiness, inconsistent parenting is important. When I see kids, over the years, many times I've also had to see the parents, because the parents are also a big problem. One of the big things is the teacher with undiagnosed ADHD with your child or with your young adult in college or anyone in college, because they aren't organized either. And for them to stay organized to teach you is very stressful for them. And sometimes that dynamic just is not very productive in the classroom. Difficulty establishing routines. Road rage is a big one. And like I said, that frustration of waiting in line at the grocery store. And so you keep seeing how these can match up to possible DSM symptoms so this patient or person can get diagnosed. Um, Also conflict with partners, misplacing keys, wallets, the remote, not being able to sit and watch. You want someone to watch a movie with you or play cards or some kind of board game, and they can't sit still to do it. Impulsive purchases are a big deal because there's a lot of impulsivity, a lot of not planning well for these purchases that you make. Do you really have the money right now to do that? Or if you do, should you be spending it on that? And then with relationships, canceling at the last minute, forgetting to go to an obligation with your family or loved one, not being dependable, difficulty sustaining friendships. I think that is a big one that carries over from childhood. You have a lot of ADHD uh, children, adolescents, adults who have few friends and really are lonely because they don't know how to interact appropriately. Um, they don't have or they don't keep friends. So, after all of those things are looked at, hopefully um, you get with the right provider and they can see that it's possibly ADHD and start to move forward with screening and diagnosis. But what are some of the serious risks of undiagnosed ADHD? You have higher divorce rates, you have higher ER visits because of that impulsivity. You have greater risk of substance abuse because you're self-medicating that um, those symptoms that you want to get rid of to calm you down and slow you down. So illegal stimulants or other substances to just slow your mind down. You have increase in motor vehicle accidents because you're distractible when you're driving. And just one thing I want to say about that for the adolescents, if you have an adolescent out there and they have been diagnosed, please, please, please do not let them drive without their medications to go to school on the weekends. During the summer, when school is out, many times people want to take a break, but if they're driving, bad idea because you look at the billboards, you're noticing people on the street, you're looking in the store windows. Just there's always things going on in the street, looking at the other cars, and you will have an accident. There's increased rates of other psychiatric illnesses that can be present that we do need to treat. It's not just that we're looking at the wrong diagnosis, but that we are missing additional diagnoses. Adults with ADHD tend to make lower salaries. In some cases, this is not the norm because they can't keep the jobs. They don't always stay in school to get those uh, careers that they wanted. I had one of my kids that I'd seen for years went to college and decided that he didn't need his medication anymore. And he flunked out of a very expensive private school where he was staying on campus. And that really changed the trajectory of his education because his parents were so upset with all the money they lost that they sent him to community college and he had to go that route first. He's back on track, but he really had to determine for a minute because he decided, oh, I don't need meds anymore. This is a chart I like to show people to kind of tell them and give them some hope. So when children have ADHD, they tend to, all of them have inattention. It's a problem with focus and attention. That's the primary issue. Some children, like I've talked to you about, have impulsivity and hyperactivity in addition to just being inattentive. Well, as they get older into their adolescent time, the inattention never changes. And if you look at it across the lifespan, it does not change. But the impulsivity and activity tend to go down if it was present. But the recognized comorbidities also go up. So other psychiatric issues start to be more evident as they're older. They can articulate it, their level of stress and activity go up where those things become more evident. So this is an important one, that your inattention doesn't go. And that's another reason why we need to treat adult ADHD, because that is not waning as you get older, that stays constant. Another thing with ADHD, that adults with ADHD have decreased lifespan and healthy years. Why is that so? It's because they have a higher risk of accidents and injuries. They have more of a risk for smoking, poor diet, poor health maintenance, which lends, of course, to cardiovascular disease and different and other problems that hurt their overall health. Obesity, adults with ADHD tend to have more obesity. Now, that's not what you see, of course, with children. They tend to be, especially the hyperactive ones, very thin children, but the adults is different. You know, the impulsivities are there, the stressors are more, they will start to eat more um, as their life goes on. And so then those issues that are obesity related um, are more prominent. It costs the billions of dollars to take care of these patients when they aren't taking care of themselves because of the increased healthcare costs, the loss of productivity and income, the effects on the educational and judicial system. Because of that impulsivity, they get into a lot of trouble and can end up in the judicial system. I mentioned earlier that comorbidities start to become more prominent as they go into adolescence and adulthood. And these are some of the comorbidities that we look at, with 80%, as high as 80% of adults with ADHD having at least one comorbidity. So these comorbidities can be substance use, mood disorders, depression, such as depression. It can be personality disorders, bipolar disorder, anxiety disorders. So while you can have ADHD, you can still have these other ones and have to be treated for these also. I also noted here that those with ADHD are 4 times more likely to develop an eating disorder also, which is, eating disorders are very hard to treat and for patients to get over. And usually you have to treat those first before we can really make a big success with treating these other comorbidities. So now you've looked at your patient or you've looked at your loved one and you said, I think this might be ADHD. Let me talk to their provider. Or the provider has listened to the patient and said, well, let's do some screening just to see if this is really what we're looking at here. So one of the popular screeners, I'm just going to talk about this one briefly, is the adult ADHD self-report. So when patients come in to my practice where I'm at right now, we do this one as our screener. It is a validated screener with a 99% specificity. Many of the companies that have sprung up since the pandemic that screen and specifically want to treat ADHD are also using this screener. It can be like in a tear-off form, but basically you want at least this screener and not, something that one of the drug companies have put out themselves to screen, because this is a validated screener. There are extensive testing that can be done by a psychologist, but this can be done in the primary care office, in a psych office, in any venue that is screening. This is a validated screener that can be used. Besides doing that, you want to take a good comprehensive interview of the patient. So you want to look at their social history, their relationships, how, have they been divorced and how many times? What's their financial situation? What are their past medical history? Have they had a lot of broken bones and stitches, which shows that impulsivity and recklessness? You want to check on their cardiovascular status, current and past. And you may want to get an EKG, especially if it's an adult, just to be sure that there's nothing there that has not been picked up on. You definitely want to know what their current medications are because there can be contraindications. There can just be, and those contraindications can include things like I had a patient who had Parkinson's. Well, when you have Parkinson's, you're taking a medication to decrease the dopamine, and I needed to give meds to increase the dopamine. That doesn't work too well uh, together, so we needed to come up with a better plan on how we're going to treat this. You also want to make sure that you are looking at other medical issues that could impact their focus and attention. If they have sleep apnea, they're not getting enough sleep, fibromyalgia, a lot of pain and stress, thyroid conditions, which can cause the feeling of the jittery, not being able to sit still, traumatic brain injuries. So you want to take all those things into account for the symptoms that you see. And you want to look at family history and see where the family history issues are. I think I skipped one. Yeah. You also want to look at their psychiatric history. Are they already diagnosed with any other condition, depression, anxiety, bipolar? Doesn't mean that they don't have those. This could be in addition to, but it also could mean that they've been diagnosed with those in lieu of their ADHD. Is there any substance use history? And what is their developmental history, especially their academic performance? Did they always have trouble in school, but no one did anything about it? They struggled through grade school, through high school, and college, and many times they drop out. Did they have a lot of discipline issues? Could they get their homework done? So these are very important um, indicators because I'll get adults who say, I think I was ADHD, and as a kid, I had such a hard time, but nobody came forward. Uh, a really interesting story I have is I had a very good friend who decided to go to medical school when she was 50. And she got in, she made it through medical school. She started her residency in psych. That wasn't her original area, but she ended up in psych. And after she became a psychiatrist, she then realized she had symptoms of ADHD. So then she got treated herself, and she said it opened up a whole new world for her because now she realized how much she struggled to get through school when she didn't have to, if she had known that that was what her issue was. She just thought she was older and, she just wasn't attentive. She was going through menopause, all these things that were going on. And she just ignored and just had to work, extra hard to make, her medical career happen. Okay. It's also helpful to get collateral reports. So individuals that are close to the patient, other family members, or loved ones who can tell you how they were like as a child, or who at least can tell you how they are at home with their interactions with them and what they see from what their struggles are, maybe with their work environment. So, I wanted to talk a little bit about special considerations when you're looking at ADHD, and I think these would be helpful for any individual that's dealing with patients with ADHD or in your personal life with ADHD. So the first one is women and ADHD. ADHD is often under-recognized in girls and women because it's misdiagnosed as anxiety or as a mood disorder, as depression, or as low self-esteem. And these are very common because when you can't focus and pay attention when you know you can't get your work done, when you know you can't get your academic work completed, you become very anxious because you know what's down the road. You know how hard it's going to be. You know your issues with procrastination, and so you're anxious. You're depressed because maybe this is going to be another thing you're not successful at, or that you're having trouble with relationships. And that is, depressing you also. The low self esteem because you don't excel at the things you want to do because you don't have the capacity to sit and complete the work um, in the time frame that is necessary. Women develop more effective coping strategies to mask it because we are the multitaskers. So we can blame it. Oh, I got so many things to do. I've got a family. I've got other responsibilities. I've just got to buckle down and get all these things done. And you stay up and you try to get these things done. And you eventually can, but it's a lot of work. It's very demanding on you as psychologically and even physically. You're less often referred for ADHD assessment because of the misdiagnosis with anxiety or depression. You also could come in saying, I'm just stressed. I just need some stress relief. Um, what can we do for that? And that's that latched onto by your provider, possibly, and ADHD is never brought to the table. In childhood, males referred more often because of their hyperactivity. So girls tend to be your daydreamers. They're the ones that look out the window at school. They don't poke at their neighbor. They don't run around the classroom. They just don't pay attention. So what do the teachers say? Well, they're not their biggest problem because they're not acting out in class. So they're just, oh, well, they just don't apply themselves. But they're, good in class. But the boys, like I call them, are the little Spider-Men. Okay. Or even my adult patients, one of the, I had an ADA district, assistant district attorney. He would come in and he was so distractible. He'd bring his briefcase and his intent was to work while he was there waiting. He didn't get any work done. He was playing video games on his phone. He said when he went home, that was the problem too. He didn't work on cases. He was playing video games, watching things on TV that interest him. And he knew he needed help because, this was starting to really catch up with him with his work life and not getting his cases worked on as he should have. So of course he couldn't sit still. He's bouncing his leg. He's just very, very, very busy. So that's going to be noticed and maybe said, hey, maybe you are ADHD. But the quiet that just doesn't pay attention, you start thinking of all other things that may be possible. The other thing with women are hormones, and I think this is an important consideration if you have been diagnosed ADHD or thinking you're ADHD, is that when you have PMS or PMDD, that the estrogen is lower right before your periods. And if you do have ADHD, your symptoms get worse. So you get less attentive, you get maybe more anxious, and it becomes a vicious cycle. So what can you do about that? If you know you have PMS or you suspect you have PMS, talk to your personal provider. If your provider here, you want to ask your patient about these things when you're talking to an adult with potential ADHD or that has ADHD, and you may need to increase their medications. They may need antidepressants. They may need oral contraceptives so that you can keep those hormone levels more evened out, and that can be a big help. With the antidepressants, we have Prozac, which is frequently used to help with some of those symptoms to even out the mood during PMS and PMDD. With pregnancy and nursing, there's, of course, hormone shifts. The hormone shifts in the beginning of the pregnancy and the big drop during postpartum can also worsen ADHD symptoms and the comorbidities that can present. So While most providers advise against stimulant use in pregnancy, um, you may be able to at least stay on an antidepressant that is safe. It is, and several are considered safe enough to use, safe enough for postpartum and then breastfeeding. And you may also just need to get help at home during these times, especially in the postpartum um, period, and talk therapy. If it's stressful, it can be very stressful during a pregnancy and that postpartum period, and talk therapy can also be very helpful. Then, lastly, for the menopausal or perimenopausal woman, there's that drop in estrogen, which can cause, in and of itself, fuzzy thinking, memory lapses, mood dysregulation. And so, even with that, your estrogen replacement, if it is advisable for you as an individual, can be helpful. Antidepressants, again, for that mood dysregulation. Um, therapies, cognitive behavioral therapy can be helpful, as well as if you are diagnosed ADHD, adjusting your dose or starting a dose if you are now suspected to have ADHD. Okay, because we are diagnosing as older adults also. The next is rejection sensitive dysphoria. This is sort of a newer term thought, and this is sensitivity to rejection, teasing, criticism, and feelings of failure. And I think it's very appropriate because I see many patients that low self esteem, that feeling that you can't accomplish what you need to, that risk of being criticized for not performing as well as you should, um, really takes its toll. You know, in childhood, it takes its toll with a lot of teasing, and a lot of criticism from parents, from teachers, and then the teasing from the and bullying from other children. But as an adult, when this is an issue with your boss talking about you, maybe if your loved ones, you usually react with perfectionism. I have to do everything perfect. I try to do everything perfect so that I'm not criticized. I want to people please, or I give up because I just can't do it. I'm just not capable. Of depression, and also anger at those who criticize you for and reject you for not being able to perform. When you're not reached out to or responded to, this can also result in this rejection sensitive dysphoria. You text people, they don't get back to you, um, or they are having something, an event, and they don't invite you and you're excluded. That can be part of this dysphoria. So it also involves you not, as an individual, not participating in social events because you have issues with time management. We call it time blindness with our ADHDers. So you're overwhelmed with what it takes to get ready for an event, overwhelmed with the energy it takes to be social at an event, to concentrate and stay in a conversation, and also the executive functioning difficulties. So you're trying to stay involved, you're trying to stay focused, you're trying to stay engaged, and you may have to have some uh, conversations that are more involved that really make it hard for you to want to engage. So what do? You cancel. You find a reason that you can't go so that you don't have to deal with all this big process of going out to big events. And what does that lead to? That leads to loneliness and toxic relationships, with people that aren't the best for you in your social state. And also that low self-esteem is a big problem. So those things, you definitely, talk therapy could be very helpful to help you with your time management skills, with getting over these negative thoughts that you have about what it takes to be uh, social, engaged, to be invited to events, why someone maybe didn't invite you or did. So to get that negative, stinking thinking out of there and, be a happier a more adjusted person for yourself. The last issue I'm going to talk about a little bit is the stimulant misuse in our college students, our young adults. You know, we do worry about them getting it from the wrong sources, from taking a few from family members. So that's a big deal with the college population. Um, they like to use it to enhance performance. So what we've traditionally seen in practice is students like to have it for finals time because they can study for exams, they can study for finals, they can write their papers, and they can stay up, they can be sharp while they're staying up. You know, of course, they're going to crash when it's all over, but that's okay because they've gotten all the work done. So we have to watch for kids that want to come in and say right before finals time, oh, I think I'm ADHD. And it happens. It happens every year. You'll get one. I think I'm ADHD. And you can see that they're almost memorize their symptoms so that they can talk to you about getting some medication for ADHD. My response usually is, well, as an adult, I'd like to test you first. That's going to take a little, some time to get in with the psychologist. Well, I need it for finals in a week or 2 weeks. And I said, well, are you passing your classes now? Yes. Well, how did you get through the semester? But now for finals, you have to have medication. So, that does give us some pause, but it's something for those of you that are out there as providers to make sure you don't fall into that trap of thinking, oh, well, they need it for finals, because we've seen that sometimes that is not the case, that they need it for themselves, but that they want it for themselves. Well, they want it for themselves for finals, but they also are going to share it with their friends. So one bottle would certainly take care of themselves and their friends to get through their finals. Um, the other thing that we talk to the college population about is, and their parents, or if they're not, if they're on their own, about mitigating risk. So you want to talk to them about the legal and health risks of diversion, not sharing it with others, even if on purpose or, by accident. So I tell patients, do not leave it in your medicine cabinet, because people go through your medicine cabinets and they may take off a couple of them and keep them for themselves. I tell parents, if they can, to put it in a lockbox. My students that are staying in dorms, young adults staying in dorms, I advise them to get one of those strong boxes, fire boxes, whatever you call them, and to bolt it to the closet wall or bolt it to the shelf so it can't disappear. Because I'm telling you, if you just leave them in your drawer, if they just leave them where anybody can get access, they will be missing sooner or later. Because one of the things with these pills at the big universities where kids have the money to do so, many times the stimulants go for about $100 a pill. That's a lot of money if you want to sell them. But that, I also warn them that that's a federal offense. So you don't get a little slap on the hand. That's a federal, you will go to prison. So not the thing you want to do on the fly when a friend says, hey, can you get me some, from your doctor? You take them, can you share? You don't want to do that. Okay. We do have medications that are harder to misuse. This would be like Concerta, if you've heard of that. Sorry. The other one would be the Vyvanse. It's because of the way that they um, are distributed in the body, with the way they break down and distribute it, and you can't snort them. You have to find other ways to divert them, which is much more work than normally just crushing up some of the older pills that are immediate release and being able to snort them or shoot them. So these are more popular with our young adults, or any adult that may have had some issues with use misuse early in their adulthood. Um, Many of the reasons that other reasons that they will abuse the stimulus is to just get high. You know, for the ADHD patient, that is paradoxical. What we say is that it slows the ADHD brain down. But if you don't have ADHD, these are stimulants. It's legal speed, and so the person without ADHD will get high. It does curb your appetite, so, you know, people wanna use them to control their weight or just to see how it feels to be on that kind of drug, you know, just curiosity on what's going on. I'm gonna move along here because I don't wanna get too behind. I talked about that. Red flags, if someone comes into your office or someone you know, they give inconsistent answers. Coming in and knowing exactly which drug they want and which dose is should be a red flag. Not wanting to provide records from their pediatrician or their other provider for past records can also be a red flag. Um, that I'm sorry, that something is going on. Refusing to take a urine test, drug tests to see that they have it in their system already or they don't have it in their system. Because if they say, oh, I take it every day, and then you do a drug screen and there's none in their system, they're not taking it. They're diverting it probably. So let's go on to med management so I can wrap it up. I don't want to go over. So, how do the medications work? They increase the dopamine and the norepinephrine neurotransmitters in the brain. These neurotransmitters play a role in focus, attention, motivation, and executive thinking, all the things we want to help the ADHD patient with. So basically, it shuts out the noise and makes you attend to whatever is in front of you, the work, the meeting, whatever it is. Decision processes, this is for my provider colleagues. You want to look at what kind of compounds, what form of administration, it comes in different forms. How long do they last? They last for different amounts of time. What is the delivery system? Is it a pill? Is it a liquid? Is it a patch? Um, how do you want to dose it? If the patient has preferences from their um, own use or family use, and then what is the insurance coverage, um, which is important because their meds are very expensive, even though they're very old. Meds for ADHD have been around since the 1950s. They're old, they're relatively safe, but insurance is, you know, this is something that one needs to be treated just like other conditions, medical conditions, so the cost stays high. And then what is the patient's copay? Because even if the insurance covers it, the copay is high, they may not be able to do that. With the adult patient, it's important to also do a good cardiovascular assessment. You may want to get an EKG just to be safe, but every visit you're going to watch for palpitations, chest pain. Do they feel like they may faint? Are they having um, any issues of that sort besides maybe headaches and stomach aches that we need to address? But every visit as an adult patient, whether it's you, someone you know, a patient, you should be getting blood pressure, you should be getting heart rates just to make sure that everything seems okay. And if it's not, then you need to do further investigation. I've just included these charts here to show you what are some of the common meds. We have two classes, methylphenidate and dexamphetamines. I tell patients it's apples and apples. So do you like Red Delicious or do you like Jonathan's or whatever? And whatever works better for you as a patient is the one we can use. Whatever works better in your family is important to use because ADHD, I think I skipped that slide, is a hereditary condition. And most kids that are, if you're a kid with ADHD, we're going to look and see if the parents are also, if the parents are ADHD, 50% of their children will probably also be ADHD, okay, at least. But these meds just show you what's available in the methylphenidate family, how they come, and how they can be used. So if you can't swallow a pill, you can open this capsule and put it on applesauce. This is one of our newest ones here. You can actually put it in water, which is great. Just 2 ounces of water, and then they can take their meds without having to fight to take a pill. We also have oral disintegrating. We have a patch that can be worn, which can be used and taken off out, earlier to cut down on the hours that it's needed if necessary. We have a liquid, we have a chewable. So we have very different. This is one that's unique. You don't give it in the morning if you can't get up. You usually need to take these meds about 2 hours before you need them. Well, if you can't wake up, you don't want to wake up, this one you can take the Jornay at night. You take it around 8:30. It doesn't start working until in the morning. So that way you don't have to wake up early. You don't have to miss your dose because you're one of these people that likes to sleep to the last minute. These are your dexamphetamine preparations. Same thing. You have tablets, you have capsules, oral disintegrating, chewables. You can open some of these up also and sprinkle on applesauce or yogurt. These are at the bottom here, they're non-stimulants that we have out. These are ones that are not those scheduled medications that are usually second or third line in treatment. The Intuitive and the Capve help with the pokey behaviors. I'm poking my neighbor, I'm standing up, I'm doing these things. It helps with those things, can help with sleep. They're a little sedating. They're actually old blood pressure meds, Intuitive and Capve, clonidine and guanfacine. Then our newer one here, Quelby, and then our older one, Strattera, are non-stimulants. Those can help with patients, especially my adult patients who are drug tested at work, have a zero tolerance at work, so that they can still have medication that is helpful, but without having a stimulant. These two slides, the same meds for the most part. For my nursing colleagues, it'll tell you how long the meds last, which is important if you're going to consider using them, and what are some starting doses. So I won't go over those. I did add a slide for my nursing colleagues on a new patch. It's the first dexamphetamine patch that was approved in 2022 for 6 and up. So this one is equivalent to the methylphenidate patch, the Daytrana, which is very similar in how it acts, its actions. Again, those non-stimulants that I talked about, the two ones that help with the pokey behaviors, the other two that are also non-stimulants that can be very useful for adults when they cannot be on a stimulant medication. And then off-label for adults and children, sometimes we try bupropion. Excuse me, it was a bug in the way. Bupropion, which is Wellbutrin, which can be helpful. Why can it be helpful? Because it works also on the dopamine and the norepinephrine in the brain. So potentially it could have some use. The other two have positive studies, but really aren't used on a regular basis. Side effects with ADHD meds. These are all the side effects that can be possible. Our most common ones when someone starts would be not sleeping well, some GI upsets, and the decreased weight. Those are the big, and headache are the big ones that I tell any patient may be a common one. Some of these others, of course, if those occur, we may have to look at it, adjusting the dose, especially the agitation, irritation, irritability. It doesn't cause tics, but if you have tics, it can make those tics worse. So these are the common side effects. With those, what can we do about some of them? With the insomnia, make sure they're not taking their meds too late. Sometimes you need a small dose of the med to keep your mind calm. So it sounds like that is counterproductive, that I would give the med and wouldn't that keep you awake? Well, if you're someone who wants the meds wear off, after the 10, 12 hours, and you're thinking again, and your mind's all over the place, a little dose, a small, immediate dose can help your mind slow down. And if it slows down, you can go to sleep. So it can be very helpful. Besides, you can use those alpha agonists, those two meds I talked about. There were the old blood pressure meds, the Capivae or the Intuitive. You can also think about melatonin if you just want to add something that is not uh, something that's over the counter. For the GI, it's usually taking their medication with food. For decreased appetite, um, just make sure you have a nutritious diet. Normally, by the evening, the meds have worn off and you're hungry for dinner. So make sure you're eating a good, nutritious dinner. I tell people during the day to drink protein shakes. They taste better now. There's so many varieties that will give them the calories and the nutrition that is important. Um, with the weight loss, as long as it's not about anorexia, then we just want to keep on the diet. If there's too much weight loss, and of course, we'll have to think of something. We have to use maybe one of the non-stimulants would be better. Looking at the headaches, we may have to adjust doses or the delivery system. Dry mouth, drinking water throughout the day, sips, chewing gum, constipation, using some medication. Sorry about that. And if there's hand tremors or jitteriness, to make sure the dose isn't too high. Are they drinking a lot of coffee? Because a lot of ADHDers self-medicate with caffeine until they're diagnosed and put on meds. So they drink a lot of Starbucks, a lot of shots in their Starbucks. Are they taking other meds that make compounded, and they can take some propranolol to help counteract the jitters. The irritability could be the dose, so we may want to look at the dose. Also, if they do have bipolar disorder, if a patient or someone you know, putting them on a stimulant can make their bipolar symptoms worse because their mania could be worse. So that's something to seriously make sure you don't miss. Who should be treated? The prior approach was to treat the comorbidity. So all of these first before you got to the ADHD. Now what we're looking at is if your comorbidity is severe, then treat that first. If it's not, and it's a small, it's been manageable, but it's present, you will treat the ADHD and the comorbidity at the same time. So I'll give you your stimulant and maybe your antidepressant or something for your anxiety, or you start your drug treatment program. What is non-medication strategies? Your ADHD coaches, you can look up coaches and find those, which can be very helpful with executive functioning skills, with time management, with just being able to manage your life and put things in perspective so that you can function better. Psychotherapy, so you can look at those dysfunctional thinking patterns that you have about your low self-esteem, depression, if you are being criticized a lot, your relationships. There's digital therapies, neurostimulation, biofeedback can be very helpful. Make sure that you have a nutritious diet, especially proteins, because a lot of sugars cause you to have that spike and then that drop off, which is not good for the ADHD brain. Exercise is excellent to help keep the brain, help with focus and attention. I always tell the parents, put the kids in karate, something that's disciplined and active. Don't put them in baseball out in third field, left field, and they're wandering away. Put them in something that helps give them the exercise and some focus. And the same thing with adults. And adults sleep, make sure you're getting your 8 hours of sleep as much as possible, because a decrease in sleep can add to your anxiety, to your depression, which also, and your focus and attention. Taking a good vitamin, and if you want to take fish oils, there is documentation, studies that show that those can be that the fish oils can be very helpful. Additional strategies, and this is it, is to work in smaller increments, take breaks so that you can help refocus yourself, and then just take a break from the work. Utilize planners and apps to help with working memory and organization. Utilize auto bill pay, carry minimal cash so you don't have that impulse to spend your money. Start with small routines to get yourself organized. So start by making your bed every day, by, making sure the dishes are always washed in the sink. And then you can move up to other activities, especially around the house. Don't turn on the TV while you're getting ready in the morning because you'll get distracted and then you won't finish getting ready. You'll get tied up in the news or the TV show. Schedule bigger, harder tasks in the morning because you're more alert. By the end of the day, you're kind of worn out, and that's not the time to start an important assignment. Check your emails after you have, trying to get this down more. Check your emails after you have planned for the day, and then do it at intervals. So don't start your work day with checking the emails. Get organized first, check your emails, and then every maybe 2, 3 hours, check your emails on a schedule. Don't go in all day because then you get in that rabbit hole and you're checking emails, clicking into something, and your work is not done. And that is it. I'm sorry I had to rush a little bit, but I wanted to make sure I got through all of the slides for you. And I hope this was informative for you, professionally and personally, if necessary.
Thank you very much. It was wonderful. I did have one question that came up in the chat. It says, can you talk about a patient of 46 years old coming in for ADHD screening, no prior diagnosis?
At 46, like I said, you would ask the questions. You can do the adult screener as a new patient. You can add that to your intake paperwork just to see what it says if the patient thinks when they make the appointment that they might have ADHD. Your family history is very important if you think parents had ADHD or siblings had ADHD, because it is very inheritable. If you get that good history on their educational success, how they did in school all along will be very helpful to you. The other thing that can be helpful is if they have, at that age, they're not going to have records from their pediatrician or any of those things. But if they can show with their work record that they, don't stay on task and they've had multiple jobs because they can't get their work done, you can do have a collateral information from their, their husband, wife, partner, good friend who says, oh, they can't sit still. They're always butting, interrupting conversations. They stay up late. They can't sleep well. All of those things can help you to do this. So at this age, you're going to do a lot based on their history that they can tell you about what's going on. You can do a urinary drug screen if that's something you can do in your office, just to make sure that the patient is not on any other kind of illicit drugs that they're not going to tell you about. And they should want to submit to that if they're very genuine. And then do a good screening to make sure cardiac wise, health wise, they're okay. And then try them on a medication. If they're healthy, symptoms seem like they're there, you make sure there's no bipolar disorder that's possible, so that you don't get into that with a stimulant. You can try a stimulant. The stimulants work best if the patient isn't very willing to maybe try a stimulant, they're apprehensive, then start with the Strattera or the Quilby, the non-stimulants, and you can try those first. That's a good option to try one of those too. And if they work, great. If they don't quite get the focus and attention for the patient, then you would try a small dose of stimulants. For our stimulants for our adults, you want to do an extended release. Do not do the immediate release Adderall or the immediate release methylphenidate or Ritalin. You want to do the ones that last throughout the day for them, because we're making sure that we're not giving an immediate release to a potential person who will abuse the meds or divert the meds. They don't usually want the extended release meds, they want the immediate release.
Thank you. I did put the link to the screening tool that you mentioned in the
Yeah,
chat. So for anyone
great.
that's interested in that, I also see that Dr. Stahovich has her hand up. So go ahead, Dr. Stahovich.
Kind of just answered it. I was actually thinking about how perspective might be different, because I was thinking, and I do have a second question that needs to be answered. So the first was, in kids, we usually give a dose right before school, and then we sometimes give the parents the option of, and then, you know, sending a letter to school for a second dose in case they have after school activities, especially ones like tutoring or music. But in adults, you know, you don't have school. The other thing that I see in kids a lot is sometimes parents do drug holidays or summer breaks, or they do vacations of drugs on the weekends. What are your thoughts on that in adults, and against it, for it, you know, pros and cons?
No, I'll do it with the kids if they don't eat well. That's usually my only caveat. If you have kids that don't eat well, so they're thinner and they tend to grow over the summer, I will let them take a little holiday. But I tell the parents, if they're going to summer camp, if they're going to summer school, anybody that's driving cannot take a holiday because you're driving, okay? And you don't want to have a really bad accident and that attorney finds out that you should have been on medications, but you took a drug holiday. And that's why you were inattentive and had this horrific accident. Not going to be good for you. So I tell parents with teenagers going to summer school, they're doing any activities, they got a little job, or they're driving, they're on their meds all summer. That is not an option to take a drug holiday. But for the littler kids, sometimes in the summer, some parents don't want to give it on the weekends, so the kids will eat. So that's usually my biggest thing. I always weigh them every visit to make sure they're not dropping weight. And if you have some that are already thin, if they'll eat better on the weekends and they're not doing anything except sitting around playing video games, watching TV, outside playing, and they don't have problems with fighting with other kids, I don't mind. I really don't mind. Because that won't last that many summers that they get to do that, because they'll be driving and doing other activities on the weekend that cause it. I've had kids kicked out of the Y, kicked out of after school programs when they're not on their meds. So it doesn't behoove them not to be on their meds, because the long-term effects of being kicked out of after school care, are not good for the kid. The first part, what did you ask about the first part? Oh, the dosing. My young adults in college, they're either going to school during the day and working at night, or going to working at, or working in the day and going to school at night. So depending on how long their day is going to be, they're going to be on an extended release, and then I put them on a shorter acting, if that's going to get them through late enough in class, especially class, because they're not going to be in class maybe past 9 o'clock. They could take a dose about 5, and that would hold them until they got out of class. If they are going to be working really late, then you can do a long acting, 2 long acting. So you do the one early, maybe about 6 o'clock in the morning. That's going to wear off that, late afternoon, early evening. They could potentially take a dose. What would be nice for them to take at this point for an extended release, you might want to consider a patch, because you can take the patch off whenever you want. They typically continue to work for 1 to 2 hours after you take it off. So you could take it off, and maybe they need to be up till 11 or 12 midnight. Maybe they work a job and then they got to close. That would be perfect. They could take it off, still have coverage, still be on task to get their work done or their studying done, but the patch is off. So that's another thing to consider to help them to be successful for the long days that they have to deal with.
Great suggestions. Thank you. There's numerous comments in the chat thanking you about what a great presentation this has been. Thank you so much. Dr. Collinsworth says that she feels very lucky to work with you, and thank you so much for sharing your expertise. So this is great. Also, Jane Garvin made a comment that drug holidays can actually damage family relationships. So that's probably something to think about too.
That's because if they don't take them on the weekends, they're not agreeable with the family. You know, parents will say, my kids are like different animals at dinner because the med is worn off. Their metabolisms are like jet fuel. And so they burn it off many times quicker. So at dinner, they're disagreeable. They don't want to do their homework. They don't want to get ready for bed. Well, an adult, the same. They get their minds get disorganized and then they get very irritable. So that's why I said, really just take your meds. If you don't want a stimulant, then take a non-stimulant. Psychologically, it can work if you have some issue with a stimulant, but the stimulants work great. They've been around since the 50s. They're relatively safe if you're healthy enough, and they work. And it has changed people's life. I get so many parents or young adults say, this has changed my life. I didn't realize how bad things were until I was on meds and could see the world differently. You know, parents say, I have a new kid here because we aren't fighting about getting up, getting work done, going to bed. They're happier. Their teachers aren't having to fuss at them all day. So it really can be a life-changing medication for patients if it's done correctly. You know, and really, I keep all my patients, I see them like you should see them every 3 months because of the legal issues with stimulants, Schedule II meds. And I see them like clockwork, and seeing your patients that often, you really get to know them and you really get them in a place in their heads where this is just part of who they are. If they had diabetes, if they had heart disease, if they had asthma, they'd have to take their meds and do it the right way. This is no different.
Go ahead, Donna.
I have a funny story about adults. I used to work at a medically supervised weight loss center. This is before Ozempic, and this is when we used phentermine. And we had to have a certain BMI. You had to be large enough to qualify, plus your blood pressure had to be low enough. Well, I had patients that didn't know they had ADHD. They started the phentermine for weight loss, and they came back to me wanting more, and it wasn't for weight loss, and they wouldn't be big enough. And I'm like, I can't, prescribe this. You need to go see someone else for what you're asking for. But we found a lot of patients responded to the phentermine in other positive ways besides weight loss, and I didn't realize it was a off-label use for ADHD.
Yeah, I mean, there's been so many things, a bit like the modafinil. There's been other meds that are stimulant producing that work, because if it's anything that's working on the dopamine, the norepinephrine in the brain, potentially can help. That's why I said you have a lot of adult patients self-medicating. That's why Starbucks can be on every corner on one street, and they're all super busy because half of those people are ADHDers who are getting a what's the big one, the Vente with 3 chips in it every day, maybe twice a day, because that caffeine is keeping them settled down. Parents will say, oh, I let the kids drink coffee in the morning. I'm like, no, that's not necessary. We'll put them on medication, and they don't need coffee at 5 and 6 years old. But it works, it helps calm their brains down. So whatever works, right?
Dr. Friedman, sorry, thank you so much for this presentation. I would just kind of say that I think it's better for the adults to keep getting the coffee because yeah, I think because like I think you most of the things you said, I really appreciate the fact that you were answering virtually every questions on everybody's mind along the way, which I think is excellent. But just looking at it from the world that we currently live and the things that are going on in the world right now, post-COVID, everybody has ADHD. People go online, and if you look at it, you can relate to one of the
that is such a big issue. During COVID, one of the companies I signed up with, I said, oh, I'd love to do ADHD. I've done fellowship in ADHD with Mayo Clinic. I've done all this extra training. I'd be great. I resigned the first day that I actually worked because they didn't represent themselves correctly. And I said, it is impossible for you to tell me after, I mean, I've already been in practice 25 years at that time. You're going to tell me you screen every single patient, regardless of what they came in for ADHD. I said, that is not appropriate because the patient, it's not that you're trying to miss a patient with ADHD. You're also worrying about that diversion issue. If when the word gets out that you can come to this company, they'll screen you. If you answer the questions correctly, you will get the med. That is dangerous. So those companies which have been sued, which have been under a lot of scrutiny, without naming names, with the FDA and everyone else, they really should be done with now because they don't have the right processes in place to make sure that this doesn't happen. And the other thing that this caused, which is really frustrating for me, is that because now they put all these adults on the medications, my children can't get theirs. But here's what I see. When these adults go to the pharmacist says, oh, we're out. We don't have it. We can't get it. Blah, blah, blah. I rarely have all of my kids not get their meds. So I applaud pharmacy because what I think they're doing is saying, if anybody gets it, it'll be the children because the children don't have a choice in their ADHD. They've been tested. It's been validated. The teacher, everybody can validate, yes, they're ADHD. And they needed to go to school to be successful to get through their academic careers. If you as an adult need it, you can go to work. You might have a harder time. You may have to really buckle down, but you can make it through a day at work where that 6-year-old, 7-year-old who's hyperactive cannot get through a day at school without being a disaster on everybody's plate. Okay. So I do applaud pharmacists. So I only see kids now. My new practice only see kids in Vegas. I don't have a big problem with the children really getting their doses. It's the adults that I still have in California that are saying, I can't get my meds. I can't get my meds. I can't, and I don't give them any. I said, I'm so sorry. We'll have to do what we can do. I don't go overboard because I know what the problem is. They got to save it. If they do have some doses, they try to without saying it, prioritize my children. So I'm very happy that I think that's what's happening, but you are 100% right that these companies that came out during the pandemic, if you look at the companies in and of themselves, they were all started by entrepreneurs. They were not started by physicians or anyone in the medical field. They were started by people who saw the money potential that was available to them. Yeah, so the CEOs of all these companies are young entrepreneurs, young people who have money to start this up, and then they gotta have a medical director, they gotta have the clinicians, but their bottom line is to make money and make it as long as they can.
I know both Dr. O and Dr. Stahovich are in California, and they're both putting that they're experiencing significant shortages there and wait times to get medications.
Yeah, now, where are you? Donna, are you back in California? Yeah.
San Diego area.
Okay. What I usually tell parents to do is I find that Costco.
Sometimes I have to call around a few different pharmacies.
I find Costco, Walmart are better because they're such big box companies.
And they prioritize kids.
They have the resources also to really stock up on the meds. They have the money to make sure they can get it. Sometimes the small mom and pops are good. The Spencers, I don't know if they don't have Spencers down there, but a small pharmacy that only has one location, because they also aren't as busy and they're stocked is smaller, but they have it. Who I find is who's the absolute worst? CVS, Walgreens, forget it. I am shocked when a CVS has the medication. Shocked. Because they will tell you, no, you can't even call around because they say no. They say no. Sometimes they're worried about adults shopping for it because they know all these companies are out there. But I've really had much more success with the Costco and the Walmarts, Sam's Club, those places that are huge. Even the Smiths sometimes, even the Vons sometimes can get it. But those two big boxers and then the tinies are what I tell the parents to do. And they usually have some success with that. So try those. And one of the reps for Asteris came by the office last week, and she said, you know, what you want to do is when you call them, don't say, do you have it? Say, I need you to order, because that's a different way to look at how you're asking. So instead of saying, do you have this, which sounds like you're just shopping, saying, you know, my child has ADHD. I need you to order this for me if you don't have it in stock, because, you know, they need it for school. And talking to them in a different way can be more successful. Now, that was her suggestion when we were talking about the medications. So it wouldn't hurt to try it.
Thank you so much. Good. I don't see any other questions in the chat. Again, we appreciate your time and your expertise. And if there's any other issues or questions, I know you'd be happy, I would think, maybe to have
Yes.
people reach out to you with questions if they think of
Yeah.
anything later. Hate to speak for you there, but thanks again. And thank you all for attending. I appreciate your time and your attention.
Okay, thank you. Bye-bye.
Okay, bye.